Welcome back. You may not know it, but this Friday is World Spine Day. So we're focusing on tips today on good spine health because it really affects your overall health. Joining us today and sitting next to me, Patty Takeuchi, who is a registered physiotherapist, and Teresa Draper, registered massage therapist. Welcome to the show, ladies.
Thank you.
Yes. How significant is good spinal health? Because really, our back connects us to everything in our body. So how important is it to be coming in and getting assessed?
Well, it's important. Our spine's very important because it affects, if you're in pain, and you can't do anything, right? It's, and a lot of people present with back pain. A great percentage of us will have back pain in our lifetime, and it can be from a lot of different causes, like postural causes. It can be from injury. It could be from an old injury. Some of the people that we see have had injuries years ago, and then it manifests later on because they're getting weaker with age or they've done something else. Work injuries, anything else.
Sport injuries.
There you go, yeah.
Childhood injuries will pop up when you're older.
You know what, that is the truth, isn't it? Things that you do in your childhood, you think, oh, that's fine, and then you get older and it comes back to haunt you.
So simple little falls that parents think, oh, that's associated with childhood. Sometimes they should be checked.
Okay. Most important thing to know, though, is that you do not need a referral from your GP to come in and go to a physiotherapist or a massage therapist. So people need to first know that. They can just phone up and make an appointment, and that's great. And a lot of people's health plans pay for this, so it's something to absolutely be thinking about doing. When you guys are dealing with somebody that comes in, it's their first time, what are some of the myths that you have to sort of debunk from them?
I think
Imaging,
yeah.
Imaging.
I was just saying. A lot of people will come in and say, "Oh, I've got arthritis all the way through my spine," and we develop arthritis and we show signs of aging on X-rays in your late 20s. So some people can have maybe a poor-looking X-ray, but they don't have symptoms. So sometimes it doesn't correlate. But still, if someone's having symptoms like weakness or a lot of pain, you still want to get things cleared. So that is one thing. Some people, so it can make people a lot more afraid if they've heard things that they've got degenerative disc disease, because we almost all do. But whether or not that's significant or not, so it's important to come in and get an assessment, because we'll look at the muscles, we'll look at your posture, how do you walk, and then assess your strength, because that's very important, strength of different muscles as you get older. And when you're young too.
Absolutely.
Flexibility.
We have 4 posters, and I don't want to forget to look at them, so I'm wondering if we can pull these up. Tips for a healthy spine. Let's take a look. Sleeping on your back or stomach can put strain on your back or neck. Sleep on your side with a pillow between your leg. I sleep with a pillow between my leg. I just find it more comfortable. Is that a good thing to do?
It is good, yeah. Put your legs in alignment. A lot of people do this after they've had hip surgery or back surgery too. So.
Making sure your pillow that's under your head is not too thick, and it shouldn't go below your shoulders. It should wrap around the top of your shoulders.
Okay. Next tip, change positions every 30 to 60 minutes when you're at work. Avoid holding a phone between your ear and shoulder. I've heard that. It can crick over your neck a lot, right?
The other thing too is seat position. So your office seat, and same as at home too, your hips shouldn't be lower than your knees. You want to keep your hips higher than your knees to avoid strain on your back.
And so many of us sit at computers a lot of our day. So something you got to think about.
The kids play video games for
That's
hours
right.
too.
Of course, this is an obvious one. Lifting, don't lift with your back and upper body. Don't bend and reach when lifting. With heavy objects, push, don't pull.
Yeah, and if you can use something to lift someone, like if you work at the hospital, use the overhead lifts. There's a lot of workers at the hospital are taught don't lift, like use the machine or the overhead lifts to move patients, because you're doing it all day.
Absolutely. And tips for a healthy spine, again, for information, isn't that you?
That's me.
For information on exercise, posture, and workplace optimization, consult spine experts, including you guys. So again, good to come in and get assessed. Don't be afraid to find out sort of what's wrong, because if you put things off, they're going to get worse, and I'm sure you see that too.
Yes.
Yeah. And there's different techniques that we'll use, like Teresa.
Let's hear about the techniques.
I do a fascial release, so you're getting into the tissue. A lot of people think it's, or heard deep tissue work, but it's actually you're releasing the fascia, and it's supposed to be not painful if you're doing it right. And I do a muscle energy, where you're actually putting a person into certain positions and then having them resist against certain angles, and it helps to realign or make things function better.
Okay, so those are some of the things that you do. And what about as a physiotherapist?
Well, one thing that I do with all my patients is assess their flexibility and their muscle strength and take a look at their core. So it always includes some kind of home exercise program and checking it when they come back in to make sure that they're doing things properly, because a lot of times, you know, your core strength, which everyone, you know, you hear things about core strength, and that's a lot of that is even your gluteal strength and having a strong bottom and strong abs and strong back. So that's what a lot of the exercises are directed towards, and keeping flexible.
Okay.
Yeah.
What are you guys doing for World Spine Day on Friday?
Anything?
Well, I'm on my way to Vancouver
There you go.
to go see Body World, so I don't know about you.
Well, that's good. It's something spine related.
Yes,
So.
yes.
Yeah.
All right. Well, ladies, thank you for being here. Very much appreciate it. Information is on the screen. WelcomeBackCenter.com. This is where these ladies work. And if you would like to learn more, you can do that. Information on the screen, 828-6740. We are back in 2 minutes. Stay with us.